Erie Shores HealthCare, formerly known as Leamington District Memorial Hospital, has been serving our community since 1950. We've grown from a single residential home on Russell Street to a now full-sized hospital that sees 45,000 patients each year. Soon, you'll hear stories from people just like you who've had a personal experience with Erie Shores HealthCare. In the next half hour, you'll meet Brianne, Mary, and Larry, who will share their stories and experiences with you. Welcome to the set. I'm Corey Robertson. First up, Brianne Paquette of Harrow shares her experience in the OB department here at Erie Shores HealthCare. Tell me how you came to come to Erie Shores HealthCare in the first place. You live out in Harrow.
Yes, so around my third trimester, I was about 30 to 32 weeks pregnant. I started with preeclampsia, and so my health became a big issue. And my options were to stay closer to Windsor or come to Leamington, where I am close to, and my family's from Leamington.
So at that point in the third trimester, what was the real concern from your doctor's point of view, maybe even from your own point of view?
So preeclampsia, it's high blood pressure, really high. That's not good on the mom, it's not good on the baby. So I had to be monitored to make sure that my blood pressure would decrease. It was in the high hundreds, and so they wanted me to be checked out by the hospital, by my doctor, quite frequently. Well, that's a big stretch for me coming from Leamington to Windsor, or Harrow to Windsor. So when I did move, I said to the doctor, listen, is there any way I can go to Leamington? I know it's not my choice, I know that's not where you're from, but that's closer to home. And he said, absolutely, would you rather me discharge you and you can go meet Dr. Oga? You know, it was welcoming. It was like, you're not a number. You're a patient. You're their team. You're part of them.
Why is that important? Why was that important to you at the time?
It was so important. It was like a weight lifted off my shoulders. It was like home. You didn't even know that there was other people giving birth because they were by your side. And even for just a checkup, you know, I'd come in for my routine with Dr. Oga. He'd walk me downstairs from the third floor to the second floor to go get my blood pressure checked, to get my weight, to get my blood sugar, whatever he needed. He walked with me. He didn't say, I'll meet you down there. He walked with me and had a conversation. It was calming. And that was so important because I don't care who you are, you deserve that treatment. You deserve to be treated like you are a patient. You belong here. You don't belong anywhere else. You belong here. And that was an amazing feeling for me.
And then there were some complications that arose.
Yes. I said, you know what, let's go in, something's wrong. So we walked into the hospital. I walked upstairs, they knew. They just looked at me and they're like, let's get you in a bed, something's up. My feet were swollen, my hands were swollen, my face was swollen. I didn't look like myself like I usually did. I wasn't happy coming up here because I was just in so much pain. They put me in the bed, they hooked me up. You know, they had to give me a little bit of medication because my blood pressure was out of the, it was skyrocketed. And they called Dr. Oga, and he was in the middle of his Thanksgiving dinner. He left his Thanksgiving dinner with his family to come and sit with me and explain to me everything that was going on. Drew diagrams. He sat on my bed and talked to me about everything. He calmed me down. He's like, your body's rejecting this. It's time. We need to have a baby. And so when I made that decision with him, we decided to come in, go home, have a good sleep, come in the next day and start my induction. And when I came in the next day, they were all waiting for me. They were happy. We're having this baby. Like, it wasn't like you're having this baby. It was we're doing this. We're a team. We're doing this.
And then there were some special nurses.
Anybody that's given birth here should know Brenda and Pamela because they are a team that nobody can defeat. They are amazing. And being a first-time mom, all the fears in your head, even though you're mentally and physically you feel prepared, you're not. So every issue I had, they knew. They already had the answer. Up until around 12 o'clock, they said I was going to go natural. And what had happened is I didn't dilate, but I was in full-blown contractions. And so Brenda came up to me and she called Dr. Oga up and he's like, absolutely, let's do this. Enough is enough. I'm not letting her suffer no more. And when I woke up again, I was in the C-section, I was just starting, and she was the first face I seen. And that was like, oh, somebody's with me right now, like somebody I know, and it's not just another nurse thrown in there. And then a few other nurses came in, the anesthesiologist and the doctors, and they all were like, we're having this baby now, it's time. And they were so excited for me. But I'm telling you, Brenda made every experience I had so wonderful. And even afterwards, I still got her. I had Pamela during the day and her at night, and it was just like, it was my family. Eventually, we want to get married and have another baby, and hands down, it's gonna be here. Hands down. I don't care, I will fight to the end. This hospital needs to stay open.
What a wonderful experience to come out of, because there was one or two harrowing moments for you,
Yeah.
and it was really the personal experience.
Very personal. It was scary. It was very scary. And all the events I went through, those are in the back of my head. It's the amazing moments that stick with me now.
Because your story is, you said that Paisley's nine months old,
Yeah.
so less than a year ago, maybe this room wasn't even going to be open, and it was.
Yeah.
And it was there for you.
Yeah, it was. And I could imagine going anywhere else. It brings tears to my eyes. Like, to be honest, like, my daughter was born here. This means everything to my family.
That is exactly, folks, why we need your continued help to keep places like this open, to keep the OB open, and to keep the services here at Erie Shores HealthCare going. And there's some great ways you can do that by calling the Foundation office at 519-326-2373, or by going online to eshfoundation.ca. Joining us now, a very special guest, Dr. Kenneth Oga, obstetrician here at Erie Shores HealthCare. Dr. Oga, thank you so much for taking some time to join us on the set here. I wanted to reunite you with Brianne.
Hi, Brianne. How are you?
I'm doing wonderful.
We have a very closely knit unit in obstetrics and gynecology in the hospital. And I have been here now for 1 year. And when I started here, the aim was to bring emergency and elective care to the community. And I think in the past 1 year, we've been able to achieve a family-friendly department. We've been able to be a community hospital, the hospital next door, to offer health care to not only to pregnant patients, but to women in the community so that they don't have to travel very far. A very good example is Brianne here that had a baby here about 9 months ago. And she lives in the community like myself and my family and 2 daughters and wife. And we've been able to make ourselves part of the community. The importance is that majority of patients want to go to a hospital that is just next door to them. They want to be able to interact with their healthcare professional, and they want to be aware that the healthcare professional can have a thorough feel of what their life is all about. The other very important thing is there is always a risk that when pregnant patients do come to the hospital, their care is usually of an emergency basis. So they need to be able to have health care that is accessible.
Folks, is why it's so important that you do your part to help us keep this hospital and these kind of programs operating right here in Essex County. Erie Shores HealthCare is dedicated to women's health and boasts a strong and newly revitalized obstetrics and gynecology unit. The obstetrics program offers patients a local choice for their special day. Our extraordinary care provides you with mother and baby assessments, a private birthing suite, OBs, midwives and nurses, and epidurals and other comfort measures 24/7. Other gynecology services can include cervical cancer screening, urinary incontinence, hysterectomy, pelvic floor surgery, and more. The hospital needs your help to assure these vital programs are available for everyone. Your broker can assist you in making a gift of stock via a direct transfer to Erie Shores Health Foundation. Giving a gift of publicly traded stock that has increased in value and that you have owned for more than 1 year may provide a greater tax benefit than giving cash. Your charitable income tax deduction is equal to the fair market value of the stock, and you avoid paying the capital gains tax on any increase in the current value over the original cost of the stock. And now, let's meet Mary Friesen, who will share her story and experience with the Erie Shores HealthCare Diagnostic Imaging Department. We are on the set at Erie Shores HealthCare with Mary Friesen, who's going to share her experience with the Diagnostic Imaging Department here at the hospital. And Mary, thank you so much for taking time out to join us here today.
Thank you for taking the time to be here.
Yeah, we sure do appreciate it. So I understand that your story at the hospital really starts with what would have been a routine mammogram.
Yes. My daughter convinced me to come for a mammogram. I didn't want to come because, like, nobody likes to come for those because they're so uncomfortable.
Yeah, was that your first? Was it the first?
No, I had one before years ago.
Yeah, so you kind of already had that feeling of.
Yeah, I knew it was coming, and I didn't want to.
Right, but she kept at you, Mom. You need to do it. Okay.
Yeah. Do it for me, if not for yourself. So
right.
I did it, and so I came in, and I was nervous, and Jill came in, and she just made it like coming to a friend's house that was like, let's just do this, or, you know, just all relaxed, and and it was not nearly as bad as I thought it was going to be.
Well, good. And part of that's that personal experience.
Yeah, it was her attitude. It was like she was really welcoming almost. It was like being at a friend's house. You know, just let's have a cup of tea kind of attitude. It was like a lot of times when you have procedures like this, it's like a production line, or, you know, you're let's just do this. This is my job, right?
So then the first results come in and you get a phone call.
Yeah, like the day after that I needed to come back because there was, it was abnormal results. So I had a really stressful week because it was a week before I got to come back.
Sure, you know, a whole week, and kind of there's what's going through your mind.
Well, I thought I had breast cancer because I had lost a friend not too long ago to breast cancer, and so I was just sure that this was it. This was my time, right?
Yeah.
And but as soon as I came in and Jill was there, and she was like, "Oh, you know, this is not a big deal. This happens all the time. We're going to use our new machine on you." And she went on to tell me all about the new machine and how good it works, and it was just.
And this was the 3D mammogram the second time around.
Yeah.
Okay, so she's got the new toy out
now. The new toy, yeah. And she said this is the only one on this side of London, so it was. She explained to me how well it works, and, you know, it does a superb job. And it's nothing. We're just going to use this machine to show you that it's nothing. It was just the other machine didn't catch it. This one will.
Tell me how important it was to you knowing you're from Wheatley, and Jill tells you this is the only one this side of London. Now, if we didn't have that here, and you, after waiting a week, and now you have to drive an hour and a half up to London, how important is it that you could get that done right here?
Well, it's very important because I could just go right from work and come here and get it done and go back to work. Whereas if I had to go to London, I wouldn't have gone by myself because I was too nervous. And so I would have had to ask somebody to drive me up there, and it would have been a bigger ordeal. And it was big enough already.
Yeah, it does become a big ordeal. So now you have this, you have the second mammogram, the 3D one. Now what happens next? There must be another phone call. They send you back to work and wait for the results.
I kind of knew that it wasn't because she asked if I had 10 minutes to sit and wait, just to make sure that the picture came back. And so I waited, and then she came out and she's like, "We got a good picture. Call your doctor and he'll have the results for you." So I was like, "A good picture." So that was like, to me that was yeah.
Sure, she wasn't talking about we got it clear and in focus.
Yeah.
Right, you got that. So then the doctor
called and said that it was clear.
Everything was clear.
Yes.
And what a relief.
Oh yeah, what a relief.
And what a feeling.
Yep.
So Mary, tell me, what does the hospital mean to you now?
Well, I mean, my daughter, when she gets old enough, she can come here for her mammogram, and it's very important to have it like right next door. We can just stop by. I work down the road, I can come by anytime, and I mean, with people like Joe working here, this is the only place to get your mammogram on. That's my opinion.
Mary, thank you for sharing such a personal story with us. I sure do appreciate it.
You're welcome.
And I wish you all the best. And folks, that's exactly why it's so important that you continue to give, and give what you can when you can. And there's such an easy way to do it. Visit us online at eshfoundation.ca. There are many ways you can support your local hospital. A bequest or gift by will is one of the easiest ways to make a planned gift. Your current income won't be affected, and you can receive significant tax benefits. With the help of your financial advisor, you can include language in your will specifying what gifts are to be made as part of your estate plan. Contact the Erie Shores Health Foundation office to find out how your donation can leave your lasting legacy. We'll meet Larry, who has been coming to Erie Shores HealthCare twice a month for 4 years. And I'm pleased to be joined on set here at Erie Shores HealthCare with Larry Roberts, now of Leamington. Larry, thank you so much for taking time to come in and share your story with us.
Great, thank you.
We sure do appreciate it. So what brought you here in the first place?
Okay, I have myelodysplastic syndrome, which is a disease of the bone marrow, which is now considered to be a cancer of the bone marrow because it imitates some attributes of cancer. And it also, I think, brings research to cancer. And with this, it does not produce blood cells. And the blood cells that it does produce are distorted.
So Larry, how often have you been coming into the hospital?
I come into the hospital usually once a month. I come in twice, actually. I come in the day earlier. I come in and they take a sample of my blood.
Sure.
It's for cross-matching, so that day they'll prepare my blood for the next day, and they cross-match it to make sure that the blood that I'm getting is identical to the blood that I have.
So coming in that often, you must form some nice relationships with some of the folks that work here.
Oh, absolutely. Yeah, absolutely. It's an incredible place. I love it here. I mean, it's just everybody. Well, first of all, when I first come in, I go to the lab, and when I get to the lab in the morning, like as soon as I get there, they're hi Larry, and they're all like my friends. Lori Toffelmeyer is the head technician there, and then there's Adele and Melissa and Lori and Marilyn, a whole group of them, and I mean, they just treat me like their friend. It's just incredible.
That really speaks to me that you actually know all of these folks by name. Why is that so important to you?
Well, because they're like my friends. They're people that I talk to. They're people who, see me every month or every 3 weeks, and take a sample of my blood and prepare my blood for me. So they're the people that are keeping me alive.
Tell me about the importance of having that kind of service so close to you here at home in Leamington.
In the morning to get my lab work done.
40, 45
yeah,
minutes.
or an hour at least. After parking that, I'd have to wait, in a waiting room and so on. I'd have to register. Then I'd have to get my lab work done. Then I would go home that day, and then the next morning I'd have to get up at 6 o'clock and drive in and be there for 7 hours to get my transfusion and then come home. So it would really be, 2 days really, and it's uncomfortable doing it in the first place, let alone, having that burden to it. I'll come here in the morning to do my lab work, and I'll register, I'll be down, I'll be out of the lab like sometimes 9 minutes. My coffee hasn't got cold in the car yet. I'll go back in my truck and drive home. So I'm home like in 15, 20 minutes, so it's beautiful. So I can do whatever I have to, I play golf, so I'll go golfing that day, but then the next day I'll come in and get it done.
Does it make traveling a challenge? Going on vacations and whatnot?
This year I went south to Florida, and I flew back halfway through. And that's one of my favorite stories, is that my nurses, who is Lynn Higgins and Tracy Jacobs and Marilyn. Yeah, I had to fly back, and they were so insistent that I go. They were ready to arrange to have somebody pick me up at the airport in Detroit, bring me here, get my lab work done first, and then do my transfusion and bring me back to the airport. The nurses wanted to do that for me. So that tells you what kind of people they are. Yeah.
Wow.
Yeah.
Does it ever? I mean, that really, that speaks to a level of caring that's I would suggest unrivaled.
That's right, unrivaled is true. And my other nurse with Tracy and Lynn is Mandy Johnson, who is really super too. There are 4 that are special that take care of me here in the ambulatory care.
Well, Larry, I'm really excited to tell you I've got a little surprise for you. Just hang tight. I'm going to bring in somebody very special in just a second. And as promised, a very special guest to bring in here. I wanted to surprise you, Larry. You know Lynn. This is Lynn Higgins, and she is an ambulatory unit clerk here at Erie Shores HealthCare. Larry, you're like your old friends.
That's for sure. Lynn takes care of me. She does everything. Yeah, it's incredible. Like whenever I need, she just leaves it to me. Whenever I need something, I just call in and she's there for me. Whatever she can do, she does, period. It's beautiful.
Lynn, we heard so much from Larry about making, personal relationships. He considers you and the rest of the team here friends, and if not even family. You must see an awful lot of people that come in here on a regular basis like that.
We do, and all of the patients that we see over here, it is a different sort of setting because we do try to create a family setting. Right, and you do the same thing, you extend the same things here as you would in your family, right? It's compassion, accountability, everything that you need to make that work. We try and do the same thing over here in ambulatory care.
Yeah, and Larry tells us his story of coming in here on quite a frequent basis, and he's been coming for, my gosh, 4 years now.
Yes, I haven't been here quite that long, but you know what? We connected right away, didn't we, Larry?
Yep, sure, for sure.
Yeah. Yes, we have lots of patients who come to us been coming for many, many years for treatment.
Thinking about what Larry comes in and he's getting blood transfusions on such a regular basis, tell us why it's so important that we continue to give blood.
Because without people giving blood, we wouldn't have these treatments. These treatments wouldn't be available for the patients, especially the ones down here, right, with any kind of chronic diagnosis that need it on a regular basis. That's what keeps them alive.
Right. I was just gonna say that when you were talking about family, is that my wife and my daughters have all met Lynn on several occasions, and when I come home, that's what they say. How's Lynn doing? How's Tracy doing? Aww. My daughters will call me. What was your numbers? Did Lynn call you about your numbers yet? So they know her almost as well as I know her and talk about her in the same way. And oftentimes I'll have my band on, my hospital band on and my bandages on. And I'll go in and people ask, like at the desk, they'll say, are you giving blood? And I said, no, I'm here to thank people. And the people who are working there really seem to appreciate it too. They get me right away and bring me over. And I'll go and from chair to chair, and I will say to them, that I have a son that was later in life, and he has 2 little guys, and without you, I would never have seen those kids. And they're very moved, and of course I'm very moved. It's something that I really enjoy, and it's quite touching. And one incident, the last time that I was in, was really kind of neat. That I went in, there was a woman there, and she heard me, and she was waiting to give, and she came up to me and she said, "This is my 50th donation, so I receive an award, like a plaque, an award or something like that." Sure. And she says, "And I heard your story." And she says, "Just made it all the more important to me." She says, "It was all the more exciting to me." So she asked me if she could have her picture taken with me. And I says, "Well, I made you one, and that'll be my first selfie."
They got his first selfie. That's fantastic. And folks, it's these kind of stories that we hear about that are only possible because of your help. And you can keep that help coming by getting in touch with us here at Erie Shores HealthCare. You can find us online at eshfoundation.ca. Here at Erie Shores HealthCare, we facilitate many hospital and hosted services within our four walls. The traditional services that people often think of include emergency department, general surgery, and obstetrics. Often, people are surprised to know that we offer other hospital services like telemedicine, cardiac diagnostics, and pediatric and oncology services. However, at Erie Shores HealthCare, we're more than just a hospital. We're also the host of many other important community programs and are constantly working with many partners. Some of those include Hiatus House, Family Services, VON, Canadian Mental Health Association, Maryvale, and more. To learn more about the many hospital and community services, please visit our website at erieshoreshealthcare.ca. During this program, you've heard the real-life experiences from Brianne, Mary, and Larry. However, these ambassadors are only a small portion of the thousands of patients, friends, and family members that we serve every year. We exist to provide compassionate, quality health care close to home. By choosing to give to the Erie Shores Health Foundation, you'll help enhance the quality of health care for your family, friends, and neighbors now and for generations to come.